Hi, so my name's Buckley. I'm a mental health improvement senior manager for NHS England within the mental health intensive support team. I've been working with NHS England for 2.5 years now, but prior to this I was a senior commissioning manager working across adult, children's and perinatal mental health. So I was based in the southwest region in Gloucestershire, which has a real mix of rural and urban localities. So lots of different challenges and lots of different pockets of deprivation that we need to take into account when we're commissioning services. So as a senior commissioning manager, part of my role was developing local transformation plans, obviously aligning to national policies such as the long-term plan, 5-year forward review, Future in Mind, Better Births, but also informed by our local demography and our local needs. So we had an up-to-date joint strategic needs assessment, and we also use local data and dashboards to reveal sort of local commissioning gaps and what the local need was. As you'll all be aware, sometimes your local needs and your local service transformation requirements don't always match exactly with what's available from national funding. So sometimes you need to develop your own local business cases and local service specifications. So I'm going to tell you about two of those that we did today. So we knew in Gloucestershire that we had an issue with our personality disorder services. We had a high number of individuals presenting to a number of our services with personality disorder. So they were coming to A&E, they were going to our GPs, they were going to mental health trust, and because we didn't have anything local for them, we were sending them out of county, very expensive out of county placements, which doesn't always result in the best outcome for that individual either. So together with the local mental health trust, I developed a service specification for an in-county specialist personality disorder service to try and keep people closer to home and to improve their experiences, and of course reduce the amount of costs and reduce the amount of money we're spending on out-of-area placements, but ultimately to improve the quality of care that these individuals were receiving. We also knew that we needed to improve our perinatal mental health services. So in partnership with both the Mental Health Trust and our local acute trust, we developed a service specification for a perinatal clinic that would cater for both mental and physical health needs for both the person that had given birth and also their partner. And this is before any national funding was available. So we took both these business cases to our governing body and outlined the business case and the benefits. But ultimately, due to funding pressures, neither of those services were funded at the time. However, a few weeks later, we received a request from NHS England, a call for bids for some small pot of funding that became available for the perinatal clinic. And luckily, because we'd had a service specification on file, we were able to use this one to respond to this request. And as you know, sometimes the timelines can be a bit tight, but so luckily we had this one on file and we were able to submit it, and ultimately were successful in getting some funding, and the clinic was commissioned with a small few tweaks just to meet the specifications of the bid. So on said all this, we were very lucky in Gloucestershire. We had a relatively well-commissioned, well-resourced commissioning team in relation to some of our colleagues in the southwest and of course elsewhere in the country. So we had more capacity to develop these kind of prospective business cases and service specs. We also had a really strong ethos of partnership working across mental health for both adults and children, young people and perinatal. And this was due, we had some very strong lead commissioners who really put partnership working at the heart of everything that we did, which definitely made life easier. So in terms of lessons learned, if you're able to develop prospective service specifications, even if they don't necessarily get funded at the time, it's always worth keeping on file, because you never know when a call for funding may come.